My name is Michelle and I am here recording my medication administration video. I am going to start by doing my first check. I am going to see what is my patient do for it. My patient's name is Millie Larson with birthday January 1st, 1936. She has unknown allergies. She is due for haldopildarole 2 milligrams intramuscular now for control of agitation. She's also due for insulin lispro 10 units subcutaneously with breakfast now for control of blood sugar. And she's due for Ducosate 100 milligram tablet now for softening the stool. So after I read all my medications, what is she due for, I am going to proceed and gather all my medications. I am going to start by doing my Ducosate. So I have Ducosate sodium 100 milligrams. I compare it to the MAR, and this is correct. The medication is not expired. I am going to put it in my medication cup. I'm going to put it right here, and I am going to continue with Lispro. I am going to prepare 10 units of Lispro. I am going to wash my hands. I'm gonna grab a insulin needle. Before I open up my insulin needle, I am going to open a alcohol swab. I'm gonna swab the top of my vial. I am going to allow it to air dry. I'm going to open my needle. I am going to pull the cap off. I am going to pull the cap down because I'm gonna have to recap. It's just for this exercise because we should never recap needles. I am going to put 10 units of air. I'm gonna inject it into the insulin. And I am going to invert my vial. And I have 10 units of insulin. I'm going to recap. And I am going to label my insulin. Lispro 10 units. My insulin is not expired. I am going to set it to the side. And now I am going to prepare my haldopildarole. So I have haldopildarole 5 milligrams per ml. So I am going to do a math, and my math yield for 0.4 mLs, that which equal to 2 milligrams, which this is what it is scheduled for. Haldopildarole 2 milligrams intramuscular for control of agitation. I'm gonna put my vial down, open my alcohol swab. I'm gonna wipe my vial. I'm gonna allow to air dry it. Just for recording, the medication is not expired. I am going to open my syringe. I'm going to attach my needle. I'm going to air dry, pull air 0.4 mLs. I'm gonna insert it into my vial. I am going to inject the air, and I am going to invert the vial. I am going to recap doing this technique. I have 0.4 milligrams. And I am going to label it haldopildarole 2 milligrams, which equals 0.4 ml. I am going to set it up to the side. Now I am ready to go to my patient bedside, and that will be my third check. So I am going to come into my patient's room. I'm gonna knock on the door, and I am going to introduce myself. I'm gonna clean up my hands, and I am going to introduce myself saying, my name is Michelle. I will be your nurse today. Can you please verify your full name and date of birth?
My name is Millie Larson. My birthday is January 10th, 1936.
Yes, Millie Larson, January 1st, 1936. Millie, do you have any allergies to medications?
No.
I just want to explain you that you have some medications too. The medications are gonna be haloperidol, 2 milligrams. It's gonna be intramuscular to control your agitation. And I also gonna have 10 units of insulin Lispro. It's gonna be in your abdomen for your blood sugar. And you also have a Ducasate 100 milligrams. That's a stool softener.
Okay.
Have you been having any diarrhea?
No.
Okay. So I am going to go ahead and do my third check. So Millie, this is your stool softener. I have 100 milligrams of Ducasate. I am going to give it for stool softener. I'm gonna open my pill and I am going to drop it. I am going to administer it to my patient. Now I am going to clean up my hands again. And I am going to put gloves in preparation of my the administration of my insulin. Millie, the insulin is gonna be in your abdomen. I am going to go 2 inches away from your umbilical, and I am going to rotate this side every time that I'm gonna give you insulin. So I am going to go in your right upper quadrant. So this is my patient. This is the umbilical. I'm gonna go 2 inches. I am going to go and wipe my patient's abdomen. I'm going to clean around in upward motion. I have insulin Lispro 10 units. I am going to pinch the skin and I am going to insert it. I am going to throw my needle into the sharp container and I am going to apply some pressure in where the site where the injection was. Okay, are you feeling any discomfort, Millie?
No.
Now I am going to give you the haloperidol for the agitation. So I have haloperidol 2 milligrams, which is equal to 0.4 mLs. That is going to go in your vastus lateralis. How I locate the vastus lateralis, it's 1 hand breath above the knee and 1 hand breath below the greater trochanter. I am going to do this motion and medication is going to go right in the middle. I am going to open another alcohol swab. I am going to also clean up the area in outwards motion. I am going to grab my medication. I am going to stretch the skin and I am going to go like a dart and I am going to give her my medication. I'm gonna pull back and I am going to throw it into medication sharps and I am going to apply some pressure. I'm gonna open another alcohol swab, apply some pressure without massaging the area, and I am going to ask my patient, are you feeling any discomfort, Millie?
No.
So now I am going to go ahead and document in my MAR the administration of the medication and how the patient tolerated. I am going to remove my gloves. And I am going to clean up my hands. And thank you for watching.